Hi, everyone. My name is Dr. Michael Wald, and welcome to this discussion, which I've entitled Dentistry X-Ray Dangers. And the reason I decided to do this podcast is because of what I have detected to be errors during my own dental visits. So I'll let you know what I'm talking about in a few minutes. So once again, my name is Dr. Michael Wald, otherwise known as the Blood Detective. I am a doctor of chiropractic, a board-certified nutritionist with a master's degree in nutrition. I'm a dietitian, sports nutritionist, and I am a life coach and also provide acupuncture. And I'll use those various skill sets to personalize and target the various health needs of my clients. So let's cover this topic of dental x-rays. And please do remember that this presentation, like all of my presentations, are meant for your educational purposes. They're not meant as a substitute for sound medical or health advice. But I really do believe that this is a critical issue in healthcare. When you think about it, people go to doctors for all sorts of reasons, and x-rays are suggested all the time. Regular x-rays, CT scans, for example, they are ionizing radiation techniques, and they carry risks. In fact, they carry cumulative risks. So your body never forgets a single x-ray that you've received. A little bit at the airport, going through security, a little dental x-ray, which they'll say is very little radiation, but the cumulative effects of radiation are real, and no one's keeping count. So it behooves each of us to have some education in this area to question our doctors. Do we really need this x-ray? Just ask your doctor. Would the treatments or treatments that you would suggest to me, would they change based upon the result of this x-ray? Really? And then sometimes asking them, well, would you take this x-ray? Is it really necessary? Changes things. You'd be surprised how just a statement to your doctor, do I really need this x-ray, results in, well, no, I think we could skip it this time. Who would have known? So let's get into this topic in a little more detail. What you're looking at right now on the right is an illustration, a graphic of DNA. That's our genetic material. So X-rays emit what's known as ionizing radiation, which leads to DNA damage by breaking the chemical bonds, leading to mutations. And that's how X-rays, by causing these breaks in the DNA, which lead to mutations, can cause all sorts of cancer. Ionizing radiation can cause the double-stranded DNA to break, and that means cells won't repair properly and they replicate themselves improperly, and replication is part of the cancerous process. Now, X-rays also generate free radicals. Free radicals are these reactive little molecules like pinballs in a pinball machine. They just bounce around, causing damage everywhere. So even when you're told, oh no, the radiation is local, the oxidative stress and free radical damage can circulate, and does in fact circulate, throughout the body. Now, I'll just say right here and now that I'm not suggesting that people never get x-rays. I'm just saying you want to minimize your x-ray exposure, and you cannot leave it up to the doctors or the dentist to do that for you. They simply don't. They recommend x-rays like many of them recommend medications without thinking. It's reflexive, and they're not thinking about the downsides. So how do x-rays cause cancer? I want this to be super clear. Repeated x-ray exposure can lead to cumulative DNA damage over time. And rapidly dividing tissues in the body, such as those of the thyroid, the bone marrow, the digestive tract, they're all very vulnerable to X-ray radiation, but any tissue in the body is vulnerable. Lack of proper shielding and excessive or unnecessary X-ray exposure obviously is going to increase cancer risk. And the cancers could include leukemia, brain tumors, even thyroid cancer. I've been to dentists more than once when they were about to take an x-ray of me, and I was waiting how long to see if they would offer me a lead shield. I had to ask for the lead shield, and then it was put on me by a technician, so I had to reshape it. So I admit, I know more than the average person. But if you knew what I knew when you walk into a dentist's office, you might never go into a dentist's office. So what about thyroid, brain, and oral cancers? And by the way, every cancer, every condition, everything that I'm saying here about x-rays and they're predisposing us to various cancers, specifically dental x-rays, is true, and the scientific evidence are very easy to obtain on either the Cochrane database or the National Library of Medicine databases. So we have an increased risk of thyroid cancer because frequent dental x-rays without proper neck shielding have been associated with thyroid cancer. Here's your mouth, here's your thyroid, here's your brain stem, here is your brain, there's scatter radiation, not to mention I've been in dentist's office myself where the technician has positioned the x-ray incorrectly. And I had to say, I'm sorry, but this is not pointing in the right place. So these technicians should not be doing this. It should be the dentist, but even they mess up. So you have to know what is right and what is wrong. And then there's association of x-rays to oral cavity and pharyngeal and laryngeal cancers. So dental radiography related cancers represent about 3% of new cancers in the oral cavity and in the pharynx. I think the number is probably a lot higher than that because, how do you even evaluate this? People are getting x-rays all the time. So how can you say this is really from dental work? So there are some controlled studies that figured at least that's this 3% out, but it's probably even higher than that. So according to the American Cancer Society, approximately 59,660 new cases of oral cavity cancer, oral pharyngeal cancer are diagnosed annually in the United States. Dental x-rays, as I mentioned, account for 3% of these, about 1,800, just a little under 1,800 cases of oral cancer every year that we know of. That's just way too much. And then we have brain cancer, childhood exposure to radiation, and salivary gland exposure. So there is an elevated risk of brain tumors. We're all worried about phones, which we should. But if you have some phone radiation and then some dental radiation, you add it up, you might have too much. Approximately 5% of brain cancers have been linked to dental radiographic exposures. And then concerns regarding childhood exposure, you should be concerned because children exposed to certain types of dental x-rays may have a higher risk of developing brain cancers later in life. Potential for increased salivary gland tumors? Yep. Some research even indicates a possible connection between dental tumors and of salivary glands from dental x-rays. Now, what about the tongue, the mouth, the throat, and cognition? So the risk of tongue cancer, we know dental x-rays increase that. The same with mouth cancer, the same with throat cancer, and the same with the cognitive effects. Just think of the anatomy. Everything is here. So what are some protective measures? So we have an increased risk due to lack of protective measures. The absence of proper shielding, as I explained, a neck shield, for example, or a neck and chest shield. And all too often, dentists skip that step. They also tend to skip looking at the mouth as one of the first things they do to just see if there's any suspicious lesions. I mean, if you're a dentist and all you have to worry about is the mouth, why can't you remember to check the mouth for cancers? That's happened to me twice in my entire life, and I'm 59 years old, that I can think of when a dentist actually looked in my mouth for that specific reason. They'll say lift your tongue up, they'll have your tongue down, they'll hold it, they'll move it around, and how many times does that happen? And then there's the cumulative risk of x-rays, because I mentioned earlier, your body does not forget any x-ray exposures. So repeated dental x-rays over time lead to cumulative radiation exposure, potentially increasing the risk of cancers. So what can we do about this? Well, the first thing is to question your dentist, as I did a few times ago when I was going there for dental cleaning, and the lady said, well, we're going to take a panoramic x-ray of your mouth. And I said, excuse me, I would rather not have any x-rays. No, thank you. Just please clean my teeth. Well, we might miss some things. That's fine. You can miss them. And if they become a problem for me, I will let you know. And they said, okay, let me go talk to the doctor. The doctor came in and says, yeah, no problem. We don't have to do the x-rays. Okay. Why would I have to ask? But we do. We just do. So here's some of the things that you might be able to do. That's one of the things I mentioned, just question them. And the other thing, if you have to get that x-ray, make sure you have the thyroid a neck shield on, the lead shield. And then nutrition even can impact dental exposure risk. I also should say that on my website at drmichaelwald.com, if you search the podcast section or the search bar on that homepage, there is a podcast that I did. It's an hour-long podcast called Radiation All Around Us. All I did for an hour was paraphrase scientific studies that I had in front of me on how nutrition, like what I'm about to tell you, can mitigate and reduce the effects of radiation on the body even years after the radiation exposure. So nutrition does play a key and mitigating role in minimizing X-ray exposure effects upon the DNA and the rest of the cells. Superfoods like berries and turmeric and green tea, cruciferous vegetables, for example, they provide very important nutritional compounds known as flavonoids and polyphenols, which help to neutralize radiation-induced oxidative stress. Nutritional supplements such as vitamin C and E and selenium, glutathione, NAC, all enhance DNA repair and reduce cellular damage caused by ionizing radiation. Is it going to reduce all of the damage? No. But can it reduce some? Yes. The studies are there. And then there is omega-3 fatty acids, spirulina, chlorophyll-rich foods, all support detoxification pathways, reducing inflammation and promoting tissue healing after X-ray exposure. So that really about does it for what I wanted to be a brief but concise, practical conversation about the dangers of dental X-rays and what you can do to mitigate those dangers. I hope this was important. Please let people that you care about know about this podcast. Let me know your thoughts as well, or any topics you'd like me to expand on. You can email me at info@blooddetective.com and check out the website at drmichaelwald.com. I'll see you at the next presentation.